evening, ladies and gentlemen. I'm just delighted to be welcoming you to Glasgow for this, the second World Parkinson's Conference.
I think this is a wonderful meeting and I am really pleased to be here. I would not have missed it for anything.
The World Parkinson's Congress has been the most fantastic opportunity to bring together patients, patient advocates, newly diagnosed people, bringing them in front of industry, bringing them in front of researchers, so you have that sense of coordination and communication.
I just want to see where we're headed and see whether my boundless optimism is misplaced.
The World Parkinson Congress is a very unique meeting. It's the only conference in the world that brings the entire Parkinson's community together, including leading neuroscientists, physicians and clinicians, as well as a variety of allied health professionals, and most importantly, the people living with Parkinson's and their caregivers. The first one happened in 2006 in Washington, D.C., the second one in Glasgow, Scotland in 2010, and the third one will take place in Montreal, Canada in 2013.
The purpose of this event is to create a real buzz, a real dialogue about Parkinson's. I think it's brilliant to get clinicians, researchers, people living with the condition together. It's really rare that happens.
What we're really working toward is to expand the knowledge base of people with Parkinson's disease and their families, helping them to deal better, more successfully with the disease.
Well, I think it's great for the doctors and the researchers to meet the patients because it puts a human face on what they're doing. I think it's great to have a human face and have a human conversation.
The best thing, I think, is to get the researchers and medical staff to meet the patients and get them to get a feel for what our lives are like.
I think mostly the contacts you make at a conference like this are fantastic. You know, the chance to see other players in the community, the chance to meet people, and also to learn more about the disease itself, of course.
One of the wonderful things about this Congress is that the patients and the family members, particularly, who are here, they are learning so much. They always had these kinds of questions. Now they can address them directly to the doctors, address them directly to the scientists.
We've been talking about new advances in treating Parkinson's as well as curing and preventing the progression of Parkinson's.
With Parkinson's, it's a progressive disorder where the care should be dynamic once they leave the doctor's office. There's a lot of other things they have to deal with, so to have all these disciplines, including the individuals and persons with Parkinson's and their caregivers here, allows an opportunity for discussion, dialogue that perhaps doesn't happen at a lot of places.
I really hope that in the middle of this, I can just sit down with various people and kind of listen to what people are saying.
We are uniquely positioned as organizations to influence systemic change in our countries.
From our side of things, it's the networking, finding out exactly practices from other countries.
When it comes to who should be attending the WPC, it's anyone who's really touched by and interested in Parkinson's. If you're interested in learning about policy with Parkinson's and how to increase awareness within governments, if you live with Parkinson's and you want to learn about the science and you want to meet other people and network, and doctors and researchers, it's a great way for them to be given hope about why they went into their career in the first place, and they can actually interact with people who are engaged with their disease and taking control of it.
Hi, I'm Alex. I'm from Henley, England.
My name is Vinci. I come from Hong Kong.
Hi, I'm Buzz Williams. I'm from London.
My name is Lelio Marquez Aragona and come from Italy.
I'm Sarah from Stockholm.
Deirdre O'Sullivan from New Zealand.
My name is Jian Kim and I'm from South Korea.
My name is Joel O'Cott. I'm from London.
I'm Rita Thompson and I'm from Scotland.
My name is Tom Isaacs and I'm from the UK.
My name is Zygmus.
Judy Spencer.
Pippi Francis.
Melissa White.
The comic.
Warren Spencer.
Beverly Condon.
My name is John Ball.
Lucy Ruchis, Denver, Colorado, USA.
I thought a particularly nice surprise this year was that we had not only the scientists like Dr. Fahn himself and the patients who were here, we also had regular clinical doctors, occupational therapists, physical therapists, speech therapists, people whose professions need to hear the Parkinson's message.
Years ago I was in Stockholm and talking with a colleague.
We've come together with this common denominator of finding a cure for Parkinson's.
So I want to say that I think this is a spectacular conference. Since I came to the first one and I'm here at the second one.
It is quite extraordinary to look out and see just how many people are here.
The Creativity Project was launched as a way to raise global awareness for Parkinson's disease. This project here represents participation from 15 countries. It's a wonderful project to raise the awareness needed for Parkinson's disease research, education, advocacy around the world.
A number of doctors have noted that when a person who has Parkinson's is actively engaged in the creative process, their symptoms subside. My true hope is that someday researchers will tap into what that hidden power is of creativity.
I'm here as a clinician to mainly gain further knowledge and update myself with the research, as well as presenting my work as a poster here.
They'd say, "Are you okay?" And I'd say, "Yeah, it's just the involuntary aerobics portion of my afternoon." And they'd go, "Ah, ah, ah, ah."
a combination of patients, allied health staff, doctors working together, you can't improve on that. That's the best.
But this is not just a science meeting. This is a congress. This is a gathering of the whole Parkinson community. And the patients and carers bring something extraordinary too. Something which only a person who lives with this disease, day in, day out, can truly understand. Urgency.
I learned quite a bit from the World Parkinson's Conference here in Glasgow. I came away with the knowing that it could be managed better, what I was doing wrong and what I could do right to live close to normal life with Parkinson's.
I'm really looking forward to Montreal 2013 because I think it's just going to carry on the torch and we're going to cure this thing eventually.
I'm at the WPC because I wouldn't have it any other way.
Life is about not waiting on the storm passing, but learning to dance in the rain. And everyone here helps you dance in the rain.